ask them to turn the lights on for just a little bit. Since I'm speaking from a well-being company, I'm going to ask all of you to stand up and find someone close to you or next to you and ask them what well-being is to them. And I'll give you 30 seconds to do this. What is well-being to them? All righty. So if you want to go ahead and take a seat, and I'm going to actually ask them to keep the lights up a little bit because I may walk the floor and ask some questions. So my name is Sean Nason, Chief Operating Officer for Healthways, based out of Franklin, Tennessee, and recently just joined the company about 13 weeks ago. So let me get all of the questions out now. Yes, I have red hair. Yes, I really am in the C-suite, and yes, I dress like this every day in the C-suite in our company. Healthways is a dynamic company that is in the process of redefining what well-being is, and that's what we're going to talk about today around even workforce wellness and the term wellness moving to well-being. So I'm sure if I asked every one of you what that definition of well-being was, we would have several different definitions. And it is an industry that is still trying to define what it means for workforce well-being. So here is today's healthcare consumer, no different than what we've heard yesterday and today, that it is a more integrated, connected, mobile than ever before in history. As I stand here on the stage, wear my Apple Watch, my phone's back there, have my computer, never get away from it because we're so integrated. The consumer is integrated in every aspect, and they want their healthcare to be integrated. So appreciated the panel beforehand that talked about on-demand care. That is actually a space that we are looking at around on-demand well-being. Or what does that look like? How can we be ever present in a member's and a consumer's life when it goes to well-being? So we have this unprecedented opportunity in the well-being space, $14 billion a year being spent. And I actually had a conversation around lunch today talking about no longer looking around, and I'm a finance person by trade. I know that's even more funny, red hair guy, finance person. I spent 7 years at the Walt Disney Company as a controller, so I understand where finance lies in a business. And the shift is going from return on investment to return on engagement. So how do we get members and employers, when they purchase products, to get engagement rates? We get asked that all the time by our sales team. What are your outcomes? What are your engagement rates in your wellness and your well-being programs? So unprecedented opportunity for us today as we move forward. Insurance only, not anymore. So as an HR person, used to, they could put their medical and benefits package together. Great, here it is, here's your separate offerings. But in this day and age, and in the demographics that we live in and the workforce where we're going today, employers need to strive to give this value-driven competitive benefits for their employees. Around corporate wellness is this growing trend in businesses. So the millennials are expecting this as part of their benefit package. And it's no longer how much or what can we squeak in, but how robust is this wellness and well-being package. But does wellness work? So I'm not sure if any of you in the room are purchasing this because that's the other question. Well, how do you bring outcomes to what you do at Healthways? So one of the powerful things, the reason I joined along with the president of our division in February this year, is we have a robust science team, health science, behavioral scientists, PhDs, that have written amazing outcomes to all of our wellness programs, from weight loss to smoking, cessation programs. We were just talking about that a little bit, mentioned here on stage, that we have these outcome-driven programs that are the baseline to what we do, and which is leading us into the future of where we want to go, and the industry wants to go as a whole. So here's this one-size-fits-all mentality, top-down directives, and that wellness engagement is tipping to meaningful, manageable, measurable, and supportive. So employees now expect more than this traditional one-size-all, as I said. No longer hand me this package, but we want a full, comprehensive, holistic approach at looking at us as employees. They also want the measurable, manageable objectives, and they deserve that holistic approach with the 360-degree insight into the whole person. So on-demand care, how does that play into the wellness space, the well-being space? How does data, as the theme of the whole day has been, drive into us what well-being looks like? This is where our operational model has changed at Healthways and where we begin to look. And it's this innovative change to the employee wellness experience must tip the scales toward a richer, more robust, human-centered design. We've heard that talked about, patient-centric, human-centered design. We have just recently created what you will hear in the industry now known as the Healthways Innovation Living Lab. It is our lab where we bring co-creation and co-collaboration with our members, with payers, with employer groups, with all of our departments within our organization to come together to create what well-being will look like in the future. The past 13 weeks, that's about how long I've been able to be a part of the organization, we have started to redefine what the future of this would look like. Employees really do want well-being. What does well-being mean? So, here's what we have ultimately decided, that well-being is this comprised of these 5 elements. They're interrelated and interdependent. So, health is there, physical, but also community, also purpose, social, and financial. So, I'll tell a story. My president and I share this. I started my well-being journey 5-6 years ago when I worked for a major payer in the industry. Was morbidly obese. Since then have lost about 50 pounds, still on that journey, in this well-being journey. But I realized about 6 years ago what totally transformed my thought process around this is a young man that I got the privilege of meeting and worked with for about 6 months externally with our company at the time, looked the epitome of a well person. Did bodybuilding, was a major athlete, football, baseball, basketball, did all this, looked it, ate as healthy as you could eat. But in 2011, he was in a car wreck. And he had a major injury to his left leg where it was crushed. And he could no longer do the things that he wanted to do and keep up with. But he still lifted weights. He still did that, still looked the epitome of what we would call a healthy person. But yet inside had lost his purpose and was dying from, literally internally, from depression. But in the industry, when they would look at him, and then they would look at me, they would say, Sean's well-being is not as great as, and I will call him Michael, Michael's well-being. Look at Michael. Michael looks healthy. Michael exudes everything. But we're focusing on the fact that Sean's maybe claims cost at the time are higher. But what they didn't realize is 6 months later, this young man ended up committing suicide and taking his life. And it so impacted myself and executives that I work with in the industry that we said we have to begin to look at things differently. I joke around about this. I don't need people to tell me that I need to eat a grilled chicken sandwich versus a hamburger, or a carrot stick versus chocolate. I know those things, but holistically looking at me, there may be some things that we need to do from well-being. So, these 5 elements. Where do we stand in the US today? Of all adults 18 and older, 28% are not thriving in any of the 5 elements. And which less than a quarter, so 19% of those adults are thriving in at least 4 of the 5. So we have a partnership at Healthways with Gallup. Many people know that. And every night we take 500 surveys across the country around these 5 elements of well-being now, and where people thrive in it, where they're impacted from it. And this was a staggering statistic to me when I learned this the first week. This is quoted in many research papers from Gallup to across the whole population health spectrum, that people are not thriving in their well-being. And what are we going to do about it? Is the question I get asked all the time. What, Sean, can we at Healthways do about doing this and making this better? So why does it matter? Improvements in well-being equal this. So if we have increased social connectivity, we all know about social media and everything, we can have higher job engagement and satisfaction, which ultimately can lead to lower health costs. So we have coaching programs within our organization, but we are even revamping what that looks like today. It's not going to be you come in for this product or this service, but you come in for our experience. So we're going to test something. You're the group that I'm going to test some theories on here around this shift from wellness to well-being. It becomes more reactive to proactive, episodic to holistic, case management to sustain behavior change. What does well-being mean for digital health? It's an unprecedented opportunity again. And what we want to start talking about at Healthways is this capability to deliver precision well-being. So how many of you have done much reading on precision medicine or where precision medicine's going? Some? So people ask us, what's the difference between personalized or precision-based well-being? And here's how we look at it. Precision well-being has to be analytically driven. So we are fortunate. We sit on, and it took me a long time to learn what this meant. Our organization sits on about 2 petabytes of longitudinal data around wellness and what well-being looks like in those 5 purposes. So we have a ton of data that we've collected from those surveys, from HRAs, from claims, from consumer data, then to our coaching, and we call our self-defined data as our coaches have entered it in the system. So precision well-being has to be based in analytically driven outcomes. So we just recently at Healthways created an Office of Data and Analytics. And today and the next 2 days, that group is actually in an offsite to really define what analytically driven does mean to precision well-being and how we at Healthways are going to use that with behavior change and the 5 elements to move us into the future. Additionally, personalized. So what does personalized mean? I said a couple minutes ago, I spent 7 years working at the Walt Disney Company. So I have a 7-year-old daughter, soon to be 8-year-old daughter, that this past March, we went back to visit Walt Disney World in Florida. So I don't know how many of you have gone to Disney within the last year and a half. So have you noticed that now for Disney, you have to go directly to disney.com and you have to enter what? Name, birth date, and gender in everyone in your party to use tickets, because they've now moved to the Magic Band, is why they say. But they gather that data on every guest. coming into the park. Simple data, non-discrete, no PHI, any stuff that data. So then you have to download your fast passes now, your keys, your credit card, everything on this one app experience. Very personalized. I put my Magic Band on when I go to Walt Disney World. I never have to carry anything else with me. I just wave this band around and it pays for everything. It opens my doors. It does all that. Very personalized, even to me, for what I want to do within the park, sends me texts. So we leave that trip. We get home. 48 hours later, I receive a text from Disney that says, Mr. Nason, it was so great to have you here at Walt Disney World. Hope you had a magical experience. And by the way, tell Princess Kayla we would love to see her for her birthday. Because they know Princess Kayla's birthday, she's turning 8 on July 7th. And so now they're personalizing stuff to me. And then at the bottom of the text says, click here at the text, click here to book your package for her birthday. Simply made. They know me, they surprise me, they make it easy for me. Personalized experiences. So our team, my team, as the Chief Operating Officer, is now working on those three principles in personalized and precision well-being. How do we know every one of our members? How do we surprise them? And how do we make it easy for them in their well-being and on their well-being journey? And last is this behavior change. So the industry has gone through this cyclical cycle, this wave. I was able to be fortunate about 5 years ago with a major payer to launch their wellness program, and we based it all on incentives. Give them incentives, give them incentives. They'll get in, and we can impact their lives forever. Well, I was one of those. Got through the program, got launched on it, and when I reached the highest level you could get and the highest level incentives that I could get in the program, guess what happened to my engagement rate? If you're a competitive person and you've reached the top, what do? A lot of people just quit doing it, and my engagement rate, I don't need to work out today. I don't need to walk. I don't need those 10,000 steps. Before I knew it, my engagement rate had slid off. So this past 2 weeks ago, was in Washington, D.C. with the top 100, Fortune 100 employers and looking at this innovation and well-being space. And they keep asking us, Sean, is incentives the way to go or not the way to go? So we have taken a stance at Healthways to say incentives are nice, but incentives will not bring behavior change. What brings behavior change is to ultimately get to the core of the being and the character of the being of a person, and help them reach a goal, reach an area where they want to go. And that's what the industry is doing. So some of you women, my wife will tell this story, how my wife is impacted in her well-being journey and has been for the past 6 years is she bought a dress that was one size too small. She hung it on the back of the bathroom door or in her closet, and she says, I'm going to get into this dress. So difference between wellness to me and well-being and to us as an industry is wellness. We will tell you, here's what you need to do, step by step by step by step. And we will dictate to you everything you need to do. In this type of environment where we look at behavior change, we want to build relationships. The industry needs to build relationships with you as a member, as a consumer, to say, what goal do you want to meet in 30 days? Maybe for someone, it's I want to be at my granddaughter's graduation. Maybe it's for someone else, I want to go hike this mountain. So as an industry, there's many of us at the table looking at this now to say, what we want to do is be able to influence the lives of our members, the lives of consumers, but not dictate to them what they need to do. So I would say as a whole, when you look at the industry, of well-being and wellness and where employees are going, this is a staple of what they want to see. Done lots of research around it. They want to make sure that it's still analytically driven. We've got data. We can prove outcomes to it. We want personalized touch, ever-present human touch in everything we do. And when we say ever-present human touch, that doesn't always mean you're talking to someone via phone, but what modalities? That's why we love the Digital Health Summit. What modalities can we bring in and what's happening in the world to help bring that touch into well-being, and then ultimately behavior change. So, as I said, we have introduced a lot in the industry: human-centered design, business model canvas. You can actually see this was a group we worked with internally and externally around looking at where disease management needs to go in the industry next and how disease management plays into well-being. And you'll see hundreds of ideas on the thing and on the board there. So, to close, want to make sure we have some questions here. I promised I'd leave about 5 minutes for questions. But remember that for us, well-being is everywhere, and well-being is everywhere. So no longer dictated, but analytically driven with that personalized behavior change to it. So got about 5 minutes left. Any questions? How do we quantify well-being? So, yeah. So I think I will say this, that is IP for us, so I can't tell you our exact algorithms and predictive models we use to quantify well-being, but I will tell you that what we are building into our quantification is those three things there, making sure foundation is built on analytics. I will say that's the biggest thing, and using not only our own data, but using data outside of our company to quantify it. But as I said, that is IP driven for us, so I can't give you all the steps that we do and to quantify that.